Welcome back to the Morning Blend. Many Americans struggle with daily chronic pain. Today, a more natural form of relief with quick results, and it works for all sorts of conditions from shoulder and back pain to fibromyalgia and even migraines.
Dr. Neal Pollack is the lead practice physician at the Milwaukee Pain Clinic. He's here with more on pain relief that doesn't involve cortisone injections, physical therapy, or surgery. Other ways to fix that pain. Good to have you here again.
Good morning.
Thank you. Nice being here.
Absolutely. I think a lot of people feel after the holidays they felt their body stress, and
Yes.
you know, it really weighs on us. You work for the Milwaukee Pain Clinic. How does your clinic different than other clinics that deal with pain?
A lot of pain clinics use a premise of general inflammation causing pain and some central sensitization. All right, that's all terms. What that means is they use a number of medicines, they use a number of cortisones. A lot of times they do destructive nerve procedures and sometimes surgery. And statistically, a lot of times these things do not work. So I have been exposed to other treatments. There's some regenerative treatments. You alluded to stem cells. We do a prolotherapy type of regeneration that's a lot less expensive and works just as well. But more importantly, there's a treatment that specifically addresses nerve pain, and nerves cause pain. Flatline, that's it.
Right.
Nerves are causing
That's
pain.
simple, huh? What is prolotherapy and how is it different?
Well, I'd rather discuss this perineural therapy. Prolotherapy is a type of regenerative treatment that builds up different tissues. And you hear a lot about stem cells. So if you're thinking of getting stem cells, consider prolotherapy because it is a safer, just as effective treatment for regeneration. But if you want to get out of your pain with various areas of the body, this perineural therapy is something that you should really look into.
Well, these are all the areas you can treat with it. So talk a little bit about some of these conditions, because there's everything from whiplash, shoulder pain, back pain, pain after surgery, chronic pain syndromes, persistent sports injuries, fibromyalgia, migraines, because this is really going in and injecting near a nerve. Is that correct?
Yes, it is. There's specific. When you have pain, your nerves are talking to you. So if you can,
A lot, right?
a lot, frequently a lot, and by resuscitating these specific areas, whether it's in the head, shoulder, back, etc., there's nerves all over. And if you identify these sensory nerves and specifically under the skin treat this so that these settle down and stop firing, then you begin to get a healing response. And it's treating neurogenic inflammation rather than generalized inflammation with sensitization and all sorts of fancy terms that invariably in a lot of cases do not work.
What are you injecting when you're going in? Because you're putting something around the nerve, really, right?
You are putting something, this something is a specially designed sugar-based solution that is buffered to specifically address the nerve stimulation and settle it down.
We mentioned that it's more affordable than stem cell therapy. So that's, I would think that's obviously another benefit to it, along with it not including cortisone.
Definitely. If you are thinking about regenerative therapy to build up, stem cells go for $5,000 to $10,000. These are several $100s for these treatments.
Is it long lasting, the relief?
You're talking about two different things now. Differentiate prolotherapy and the perineural therapy. Prolotherapy to build up a specific joint takes several treatments. If you're talking about perineural, the treatment itself can get you out of pain almost immediately if you're a responder, and then the treatment lasts for a week to several weeks, and then with subsequent treatment you ratchet down the pain.
I think people just hearing the fact that you can get rid of some of that pain that quickly and to know, like you've said, if you're a responder, you're going to find some immediate relief. That, I think, seems like you're giving someone their life back. So what do you do for people? Someone says, hey, I have this ongoing pain. What is the process? They come in and meet with you?
Definitely. You have to listen to them. You have to find out what their condition is, and you have to specifically address this. If you're talking about the perineural, you address the specific nerves that they are detailing. You have to understand them as a person too. A lot of people who come to us have been through a number of different treatments, as you alluded to. And that's just the way it is. And it's been amazing, and it's been so gratifying to see these people who have been in chronic pain for almost years get relief.
Yeah.
Relief is what people are seeking, for sure. And you can do that by making an appointment with Dr. Neal Pollack at the Milwaukee Pain Clinic. It's milwaukeepainclinic.com, or call for an appointment so you can talk about the pain you're having at 414-453-7780. And Perineural therapy is what you should talk to him about. Thanks so much for being here, doctor.
It's a pleasure.
Thank you. Appreciate it.